A space inside of the breast must be created for the implant. We call this the implant pocket. And that space can be either over the muscle or under the muscle. So let me explain what those differences are. When the implant is placed in the pocket above the muscle, we call this the subglandular position. And that's because it is under the gland of the breast. There are two major disadvantages with this position. The first one has to do with the fact that if the breast tissues are thin, which is true for a lot of women getting breast augmentation, then the implant is not going to have a lot of cushion over it. This means that over time, the edges of the implant will become visible and create a complication called rippling. The other disadvantage has to do with the fact that when implants are over the muscle, the risk of capsular contracture increases dramatically. And this is a complication where scar tissue forms around the implant, it gets hard and distorts the shape of the breast. When the implant pocket is created under the muscle, we call this the submuscular position. We also call it the dual plane. The muscle that we're talking about is called the pectoralis muscle. It is the muscle of the chest that runs in this diagonal direction. In order to insert the implant in this space, the muscle has to be opened at the bottom and a space created for the implant. This position has several advantages. The first one is the fact that the muscle provides a very nice cushion over the implant. This makes the transition from the chest to the breast appear much smoother and more natural. Another advantage has to do with the fact that when the implant is under the muscle massages the scar tissue and prevents it from getting hard and causing this complication called capsular contracture. So for all of these reasons, placing the implant under the muscle has been proven to be the safest and the best position for the implant.